So, when you hear the term clinical psychology, what's the first thing that pops into your head? Maybe a therapist's couch or someone analyzing dreams? And yeah, that's kind of part of the picture, but the reality is, it's a much deeper and more scientific field. So today, let's pull back the curtain and see what it's really all about.
All right, let's start with a number that's, well, it's pretty staggering. A major national study found that 30% of American adults, that's nearly 1 in every 3 people, will be diagnosed with a psychiatric disorder at some point in their lifetime.
And to put that into perspective, we're talking about roughly 70 million people. That number is just huge. It really highlights this massive and often unspoken need for professional mental health support in all of our communities.
Which, of course, brings us to a really critical question. When so many of us are facing these kinds of challenges, who are the experts on the front lines? Well, the answer, in large part, is the clinical psychologist.
Okay, so let's start with the absolute fundamentals. What exactly is clinical psychology? I promise you, it's way more than what we see in the movies. It's a deep and incredibly disciplined science.
Now, I know this looks like a total mouthful, but this definition from back in 1991 is a real cornerstone of the field. Basically, it's saying that clinical psychology uses scientific principles not just to treat problems, but to understand, predict, and ease all kinds of human discomfort, whether it's emotional, social, or something else.
But let's break that down into something a little more human. At its core, it isn't just about treating serious mental illness. It's about promoting our overall well-being. I love how one psychologist put it. It's like helping people clear out the mental garbage that we all just kind of accumulate in our day-to-day lives. So the big takeaway here is, it's about both sickness and health.
So how do they actually do it? What are the tools and processes a clinical psychologist uses when they're trying to help someone? What's in their toolkit?
Well, the process usually follows 4 key stages. It all starts with assessment. That's where the psychologist uses interviews, observations, and tests to get a complete picture of what's going on. Then comes diagnosis, which is all about identifying the specific issue based on established criteria. From there, they move into treatment, using therapies that are really tailored to that specific person. But it doesn't stop there. A super important and honestly often overlooked final step is prevention. It's all about developing programs and strategies to boost mental health across entire communities.
Okay, now this is where things can get a little confusing for people. The word therapist gets thrown around a lot, right? But there are actually a bunch of different types of mental health professionals out there, and they all have very distinct jobs. Let's clear this up. Let's kick things off with the most common point of confusion out there, the clinical psychologist versus the psychiatrist. They both treat mental health issues, for sure, but their training and how they approach it are fundamentally different.
So here's the main difference, right? A psychiatrist is a medical doctor, an MD, who can prescribe medication. Their focus is often on the biological side of mental health. A clinical psychologist, on the other hand, is an expert in human behavior. Their main tool is psychotherapy, what some people call the talking cure. They focus on helping you understand your own thoughts and behaviors, and they take a really collaborative approach to empower you to find your own solutions.
And believe it or not, the field is even broader than just those two. You've got counseling psychologists who often help people navigate big life adjustments like a career change. Then there are psychiatric social workers who focus on how our social and environmental situations impact our mental health. And of course, school psychologists who are specialists in supporting the emotional and academic growth of students. As you can see, each one of these pros has a very distinct and vital role to play.
So even within the world of psychology itself, what is it that really sets a clinical psychologist apart? What makes their training and their practice so unique?
Well, there are a few things that make their training really special. For starters, they're bound by a super strict code of ethics and have to go through mandatory, supervised internships. But here's the part that I find absolutely fascinating. They get specialized training in advanced listening, and most programs actually require them to go through their own therapy. Just think about that for a second. They have to understand what it's like to be in the client's chair, making sure they've worked through their own stuff before they can help you with yours.
Ultimately, the entire philosophy is really about empowerment, and this quote just captures it perfectly. The goal isn't for the psychologist to give you all the answers. It's to help you find your own internal strengths so that you can solve your own problems.
So we've taken a look at who these experts are and how they work to empower people to find their own strengths. And that really just leaves us with one final question to think about. What does better mental health look like for you?